Hello everyone, welcome to Unacademy Future Doctors. Am I audible? Let me know. Let me check. Am I audible? Sorry. Okay. No. So, welcome to Unacademy Future Doctors. I'm myself Dr. Dipti Karya. I'm MD and PhD Physiology. I'm Associate Professor and educating MBBS nursing, physiotherapy, and MD students. I have more than 17 years of teaching experience. Now, let me explain in brief about our subscription. We have two varieties of subscription. Number one, that is plus subscription. Here, you can choose the best from the best. In plus subscription, you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes. You can have printed notes. Within 12 months, we are coming with our printed notes. Next is a iconic subscription. Here, your access to the best from two of the best. We have two best options. Both of them, they are unique, having their features. One that is Unacademy and Prep Ladder with Unacademy. Features are, in this subscription, you can have well-structured live batches. You can have recorded classes, which covers your full syllabus. You can have question bank, which is having more than 25,000 questions. You can compete in live test as well as quizzes, and you can have comprehensive printed and digital notes. And second variety of subscription, that is Unacademy and Prep Ladder with Prep Ladder. Here, you can have clinical and integrated essential video lectures from the Dream Team, Question Bank 3 with active guidance. You can have rapid revision and snapshots, treasures, and 2021 Dream Notes. So you can subscribe from your mobile, either plus or iconic subscription. You can use my code Dipti10 to get 10% extra discount. Now, there are certain other features which I would like to explain you in brief. One, that is special class has important features. Number one, that is you have interactive live classes. You can attend live classes as well as you can participate in the live chat. You can get your doubts clear. Second feature, that is you can poll for the learner, respond to the poll for a better understanding of the topic. We have feature of raise a hand. You can talk to your educator in live classes and you can get your doubts cleared. You can never miss a class because you can get notification for all your classes. As well as we have well-structured lecture notes which will be provided with this subscription, and you can attend live classes as well as you can participate in the live chat and get your doubts clear all during the class. So updated and highly effective question bank also you can be provided, which is having more than 25,000 high yield clinical questions which are based on latest exam pattern. It includes detailed explanation. These are our NEET PG 2021 toppers. Congratulations to all. This is the schedule for our Unacademy medical PG test in the December. You can see here at every Wednesday, every Friday, Saturday, Sunday, different tests they are planned. Okay. Another is FMGE 2022 batch and Target NEET PG 2022 batches. They are also started from 15th December. Here, this FMGE batch, that is for 6 months, and NEET PG batch, that is for 3 months. One more announcement for you all, that is we have our NEET PG Combat. This NEET PG Combat, that is on 19th December at 5 p.m. Note the date and time. Here this is for 60 minutes. You'll have to crack 45 questions. Okay? This live test that is available on your Android as well as on the web. These questions for this combat, they are created by top educators, so you can participate in this combat. It is free. You can use my code Dipti10 and you can enroll for the test. Okay, questions, they are from community medicine, ENT and ophthalmology, and detailed video solutions, they are also given by our top educators, and you can get real-time all India rank. You can participate and enhance your preparation with our Unacademy Combat. As well as we have scholarship from a pool of rupees 10 lakhs, and top 50 participants, they can get a chance to win Amazon vouchers up to rupees 10,000. Another important this announcement here, that you can boost your medical PG preparation. We have limited period offer for 2 days. It was, this is buy 24 months subscription and get 4 months extra, buy 12 months and get 2 months extra, buy 6 months and get 1 month extra. Okay, so these are various subscription rates for plus as well as iconic subscription. Here, longer the duration of subscription, cheaper are the rates. Okay, now we'll start our topic, that is surfactant and surface tension. Okay. Another one more announcement which I would like to give you, that all the lectures on our channel, that is Unacademy Future Doctors, this is accessible freely. You can access all these lectures freely. Live lectures as well as the same lectures are available on our YouTube channel Unacademy Future Doctors. Okay? So you can access them at any time. Now, starting with our topic. So today's topic, that is pulmonary elastance, and elastance, afterwards we will discuss about surface tension and surfactant. Okay? So what do you mean by elastance? Elastance of any tissue, that is recoil tendency. Tissue is having recoil tendency or restrictive tendency of any structure. We have elastance of our thoracic cage. Thoracic cage elastance, that is because of elastic nature of our ribs, our muscles and tendons. Okay. Second, that is elastance of lungs. This lung elastance, that is because of tissue forces. In our tissue, we have smooth muscles in the lungs, elastic fibers and collagen fibers. Okay. And surface forces, that is very important for elasticity, and that is surface tension. Now, first of all, what is surface tension and what is the role of surfactant to decrease surface tension? Okay, starting with surface tension. What is surface tension? Now, as you learned in your physics in 12th standard, that whenever there is interface means air and water or two media are there. So at the interface, there is tendency to reduce or tendency to decrease the surface area, and that is surface tension. So surface tension, that is the force which tries to decrease surface area. Force which tries to decrease surface area. For example, suppose here this is a water surface. Okay, so here this part of the water surface, suppose if it is a spherical, the force is applied, surface tension is applied on all the direction. So this side of force, it is nullified by this one. But if suppose we are talking about this part, so this force is not nullified. So surface tension, that is the force which tends to minimize the surface area, and for minimization of surface area, there is a force that tends to reduce the size This is the reason why your water drop is spherical. Okay? These are the surface forces that tends to decrease the surface area. Okay? So here in our lungs, we have our alveoli, and these are alveoli. These alveoli also they have interface. Here you can see air is here, and what fluid is here? That is blood or interstitial fluid. So here air fluid interface is there. So there is surface tension. And because of this surface tension, our alveoli, they have tendency to decrease the size. Okay? So this is known as recoil tendency of the lung. So our alveoli, they have tendency to decrease the size, and this is more when our lungs they expire, because what happens at the expiration, this radius decreases further. So recoil tendency also increases. Now for that, as you all know, there is law of Laplace. What is law of Laplace? Pressure is equal to 2 multiplied by surface tension divided by radius. Now what is this pressure? Pressure, that is the pressure required to distend, or distensibility pressure, means how much pressure is required to keep this alveoli open. Okay? So when surface tension is more pressure is required. When surface tension is less pressure is required. So this surface tension increases the tendency of alveoli to collapse. Okay? Now, another is surfactant. Surfactant, that is a liquid which is secreted by type 2 pneumocytes. You can see here these are. In our alveoli, here this is the alveoli, this is the alveolus. This is pneumocyte, type 1 and type 2. From this type 2 pneumocytes, they secrete surfactant. Surfactant is made up of Yashvardhan. Hello. Yashvant. Yashas. Okay. So now, here, what is the composition of surfactant? Surfactant is made up of phospholipid. Common phospholipid is dipalmitoyl phosphatidyl choline, DPPC. Okay. So this is one of the composition of surfactant. Other is protein, that is apoproteins and calcium ions. Okay. So these are, they made surfactant. Now what is the function of surfactant, we will discuss, and what is its role. Okay. So first of all, surfactant decreases surface tension. What is the role of surface tension? Surface tension increases tendency of alveoli to collapse. And when surface tension is reduced, then tendency of alveoli to collapse is also decreased. Okay? So you can see here, whenever alveolar fluid is there which is not having surfactant, the surface tension is high. That is about 50 dynes per centimeter square. But if surfactant is present, the same pressure is reduced to 5 to 30 dynes per centimeter square. Means less pressure is required to distend the alveoli. Okay? Now we discuss about function of surfactant. You can see here, this is, as I told you, distensibility pressure. More pressure is required. When more pressure is required? When your surface tension is high. Okay. Now, what is the role of surfactant? Surfactant, you can see here, it is produced by this cell, type 2 alveolar pneumocytes, and they form a thin layer over the alveolus. And function is, surfactant decreases surface tension. So surfactant decreases surface tension, and as it decreases surface tension, it decreases tendency of alveoli to collapse. Okay. So this is first function. Surfactant is one of the very important question from your respiratory system. Okay. So as we have discussed, cells they secrete surfactant. Type 2 pneumocytes. Second thing we discussed, that is structure, composition of surfactant. Third thing we discussed, that is functions of surfactant. Surfactant has got 4 functions. First function, that is it decreases the tendency of alveoli to collapse. You can see here, alveoli without surfactant, it is like this collapsed, and with surfactant it is like this open. Okay, so this is first function. Second function is surfactant decreases work of breathing. Now what is this work of breathing? How surfactant affects work of breathing? Okay, now again we come to our Laplace law, that is T is equal to 2T upon R. Okay, now according to this, when surface tension is reduced, so you can say here, if your P is constant, so what is there? T is directly proportionate to radius. So when the surface tension is reduced, radius is your radius is increased. Okay, so surface tension, when it is reduced, your radius is increased. Okay, so this surface tension is reduced by your surfactant. So surfactant, it decreases the surface tension and thus it decreases work for breathing. It decreases the pressure required for expansion of alveoli. Okay? So this is second function. First function of surfactant, that is it decreases the tendency of alveoli to collapse. Second, it decreases work of breathing. Third, it decreases pulmonary edema. Now, what is this pulmonary edema? Pulmonary edema simply said that presence of fluid in the interstitial space here. So now, what is the role of surface tension here? Surface tension, it increases entry of fluid here. This way. Okay. Now, so when surface tension is reduced, then the entry of fluid is also reduced. So thus surfactant decreases pulmonary edema. Again, let us repeat function. First function, surfactant decreases tendency of alveoli to collapse. Second, it decreases work of breathing. Third, it decreases pulmonary edema. And fourth function, it maintains stability of the alveoli. Now, what is the stability of alveoli? Just let me explain. So, stability means all the alveoli, they have uniform size if surfactant is present. But if surfactant is absent, what happens? Some of the alveoli, they become very small. Some of the alveoli, they become large. Why? How? That we will discuss. Now, again we come to the Laplace law. P is equal to 2T upon R. According to this law, pressure is directly proportionate to surface tension and inversely proportionate to radius. So pressure is calculated by this formula. Okay? So you can say that when radius increases, pressure decreases. Okay? So again you can see, so radius increases, pressure decreases. What does it mean? When alveoli is small, means radius decreases, so the pressure increases. Okay? So smaller alveolus requires higher pressure, and therefore smaller alveoli, they have tendency to collapse. They get collapsed. I'll explain you. You can see here. Suppose you can see here, this is one small alveolus, this is one large alveolus. Okay. Now, here suppose we come to this formula, P is equal to 2T upon R. Okay. Here, suppose surface tension is constant. Like surface tension for all the alveolus is 10. Okay. One alveolus has radius of 1 millimeter, other has radius of 2 millimeter. Okay. And surface tension is same. So what would be the pressure for both the alveoli? For this first one, P is equal to 2 multiplied by surface tension is 10 divided by 1. So pressure is 20. Okay. And P here for the larger alveolus, that is 2 into 10 divided by 2. This is radius. Okay. So this becomes 10. Means less pressure is required to expand larger alveoli. So here more pressure is required. So what happens? This alveoli, they tend to get collapsed. But now, how surfactant decreases this effect? Okay. Now, so you can see here, surfactant, because it forms a layer, you can see here, suppose your alveolus is smaller. So surfactant forms a thick layer here. And in large alveolus, they form thin layer. So what happens because of this? When layer of surfactant is thick, there is decrease in the surface tension. So now you can see here, instead of 10, this becomes 5. So what would be your answer? What is your pressure now? P is equal to 2 into 5 upon 1. And here this is P is equal to 2 into 10 upon 2. So pressure is equal on both. P is equal to 10. So it will not allow smaller alveolus to get collapsed. Okay, so this is the role of surfactant. So these are all the functions of surfactant. Now, also other factors also maintain alveolar stability, that is interdependence. What is interdependence? There is continuous network of septa. Alveoli, they are in different septa. And so alveoli, they are present so close to each other that one alveolus cannot change its shape. Like suppose we are sitting in a small place, so we cannot move our hand or leg or anything. So this alveoli cannot change their volume without changing the volume of neighboring alveoli. So that is known as interdependence. Because of that also, your alveoli, they can be stabilized. And other factor is various fibrous tissues are there, which are also additional splints, and they also stabilize the alveoli. Now, certain factors, they decrease surfactant. Which are those factors? One, that is when we are inhaling long-term 100% oxygen, that decreases surfactant. When there is occlusion of bronchus, then also surfactant production decreases. Cigarette smoking also decreases surfactant production. Cutting vagus nerve also decreases surfactant production. And thyroid hormone and glucocorticoids, they increase surfactant production. Okay. Now, next is clinical significance, one of the very important topic, may be asked as a short note, that is respiratory distress syndrome of newborn, which is also maybe asked as hyaline membrane disease in the newborn. Here what happens? There is inadequate production formation of surfactant, because surfactant synthesis starts by the age of 20 to 24 weeks intrauterine life. Okay. And maximum, that is by 35 to 37 weeks. So if maximum production of surfactant, because before that it is not required, because lungs are not working inside when the baby is inside the uterus. So if the delivery is before the 35 weeks, then surfactant is not working properly. Okay. So what happens here in premature babies, this is common. Okay. So the baby is having difficulty in lung expansion. All the functions of surfactants are absent. Which are those functions? Number one, that is there is surfactant decreases collapse. So here there is collapse of alveoli. Collapse of alveoli. Second thing, that is surfactant decreases work of breathing. So here work of breathing increases. Okay. Third, pulmonary edema is prevented. Here there is pulmonary edema. And fourth, that is alveolar stability, that is also lost. Alveolar instability. So these are the clinical features of the person is having, or the baby is having, respiratory distress syndrome. Treatment, exogenous surfactant can be given, and positive expiratory pressure is also applied to open alveoli. Okay. Same way in adult also, this kind of respiratory distress syndrome may be present. This is also because of abnormal surfactant function. In case of pulmonary injuries, if the person is having injury to the lung, then abnormal surfactant functions are there. There is also sometimes patchy atelectasis commonly during cardiac surgery. Patchy means at certain areas. Atelectasis means collapse of alveoli. So, what is the reason during cardiac surgery when the person is placed on the oxygenator and pulmonary circulation is interrupted during this time? There is patchy atelectasis. Okay? So, this is about today's topic. Question from today's topic. One, that is surfactant. Very important full question. Definition, functions, and clinical significance of surfactant. Most of the students, they are not able to answer. This is one of the toughest topic for the students. Okay. Next is short notes. Short notes are lung or pulmonary surfactant, one of the important short note. Role of the surfactant in the lungs, surface tension, lowering substance in the body, discuss the formation and function surface tension lowering substance, that is surfactant. So the question may be twisted like this: enumerate the surface tension lowering substances. And respiratory distress syndrome, that we have already discussed. Okay. So this is all about today's topic. Thank you. If you like the video, you can like, you can share, and you can subscribe our channel Unacademy Future Doctors.